name's Johanna. I'm going to be your nurse today.
Hi.
Can you please state your name and date of birth?
Issa Durrani, 5/23/1999.
And do you have any allergies?
No.
And what are your preferred pronouns?
She and her.
Okay, this is the correct patient, date of birth, and allergies to identify with. So I'm going to be doing a focus assessment on you today. The exam should take 5 to 8 minutes, and if you have any questions or feel uncomfortable at any point, please feel free to stop me.
Okay.
All right, I'm going to give, the patient understands the purpose of the exam. I'm going to give you this gown. If you could please put it on with the ties in the back. Are you comfortable in this room with respect to warmth and privacy?
Yes.
Okay. The patient is comfortable and is ready for the exam. I'm going to start off by asking you a couple of questions. Do you have any problems with breathing or your lungs?
No.
Do you have any chronic respiratory diseases?
No.
Do you have any problems with coughing?
No.
Have you experienced any shortness of breath or pain when breathing?
No.
And have you ever or are you currently a smoker?
No.
Okay. If the patient said yes, I would assess using Old Carts Ice and techniques for special circumstances. Okay, I'm just going to look at you from the front and assess your breathing. If you could just breathe normally for me, please. Okay, appearance is relaxed. Patient breathing is quiet and effortless. Patient is sitting upright. And no accessory muscles are being used. No bulges or retractions are noted. Okay, now I'm going to if I can just see your hand, please. Okay, skin is warm, dry, and pink, no lesions noted, and skin is appropriate for ethnicity. Now I'm going to count your respirations and check your oxygen level by putting this probe on your finger. Okay. Respirations are 16. O2 saturation is 99%. Now I'm just going to check your nails and your lips. Okay. Nails are pink and nail beds are 160 degrees. Lips and oral mucosa are pink as well. Okay, now I'm going to ask you to turn around for me, please. Now I'm just going to assess your breathing from the back. If you could just breathe normally. Okay, ribs slope downward at a 45-degree angle. Thorax is symmetrical, spine is straight, scapulas are symmetrical, and muscle development appears equal. Now I'm going to use my stethoscope on your back and sides. If you could please cross your arms over your chest and take a deep breath through your mouth each time I move my stethoscope. Normal breath sounds are heard over the posterior lung fields. No wheezes, crackles, or adventitious breath sounds are heard. Now I'm going to check your sides. If you could breathe deeply through your mouth each time I move my stethoscope again. Okay. Normal breath sounds are heard over the lateral lung fields. No wheezes, crackles, or adventitious breath sounds are heard. Okay. Now if you can please turn back around for me. I'm going to assess your breathing from the front. You can just breathe normally. Okay. Thorax is symmetrical. Muscle development appears equal. Your costal angle is less than 90 degrees, and your AP to lateral diameter is a ratio of 1 to 2. Now I'm going to listen to your lungs from the front. If you could take a deep breath every time I move my stethoscope. Vesicular sounds are predominant over lung fills. No wheezes or crackles are heard. Okay, so now I'm gonna have to ask you to turn back around for me.
Okay.
Sorry. Going to use the palms of my hands on your back to touch your back and ribs. If you feel any pain or tenderness, please let me know. Okay. The posterior thorax is non-tender. No pain or tenderness over the vertebrae. Now I'm going to ask you to take a deep breath. Okay. Ribs are stable, symmetrical, painless, and firm. There are equal bilateral expansion of the posterior thorax. Now I'm going to use my hands on your back, and each time I move my hands, please say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3.
The vibrations palpated are equal bilaterally. Now I'm going to ask you to please turn back around for me. I'm going to be gently touching important areas of your body, like your throat, your collarbone, and your ribs. Let me know if you experience any pain or discomfort.
Okay.
Ribs are Sorry. Trachea is midline and movable. Clavicle is symmetrical and well developed. And your ribs are symmetrical, stable, and no pain or tenderness noted. Now I'm going to move my hands. If you could say 1, 2, 3 each time I move my hands.
1, 2, 3. 1, 2, 3.
Vibrations palpated are equal bilaterally. That concludes my exam. Thank you.
Thank you.